Hello, everybody. Welcome back to another episode of the Vibrant Health Show. Today, we're going to be talking about PCOS. What is it? What can you do for it? If you have it, you've probably been told there's not a whole lot you can do for it, and we just don't believe that. So we're going to talk all through what it really is, what can be done, and why some of the medical interventions aren't super successful, right? Why you've tried things that you feel like haven't worked. We're going to dive deep into all of that today. So if you're watching live, feel free to ask me questions. If you're on the replay, go ahead and put your comments and questions below. I will come back and answer all of those for you guys as well. Let me turn my volume down so that doesn't get distracting. So funny story before we get started. It's one of those you're a mom when kind of scenarios. I was getting ready to go live, and right before I went to press go live, I could see in my camera behind me that my daughter had all of her Barbies set up on my bike, and there was like a bunch of them all set up. She clearly had them riding the bike this morning. I was like, oh crap, I should move them. And for a second, I thought about just leaving them there because you guys probably would have appreciated that, but I didn't want it to be distracting. We have things to talk about today. So I had one of those moments. I had a good laugh before coming on that she had me all set up with her Barbies riding the bike today. They were getting their workout in. So feel free to share with me in the comments. If you had you're a mom when kind of moment recently, I love to hear the funny things that your kids do too. So tell me that in the comments also. All right, let's get started. So PCOS is becoming, unfortunately, very popular. A lot of women are getting diagnosed with that. In fact, the numbers are getting as high as about 20% of women under the age of 40 are being diagnosed with PCOS in some form or fashion, which is craziness. That is way too many, but it is definitely becoming really, really common, which does not mean it's normal, right? It's just common. But I'm going to talk about some of the causes of PCOS, and the reason it's becoming more and more prevalent is because the underlying root causes are becoming more and more prevalent. So we'll get to that in just a few minutes, but 20% of women, that's a big deal. And PCOS has been highly linked with risk factors for everything from high blood pressure, heart disease, endometrial cancer. There's different strokes that can go along with having the symptoms and things of PCOS as well. Infertility. I mean, this isn't just a hormone imbalance. It's not just cysts on your ovaries. The underlying root causes of PCOS are linked to some very major health conditions in women. So especially, I find I get a lot of moms reach out whose teenage daughters are being diagnosed with PCOS and they're not sure what to do and they're not loving the advice they're getting from their doctors. I definitely want to encourage you, whether it's for yourself or a loved one or a daughter, if you're having that diagnosis, take it very seriously because this can lead to a lot of intense symptoms and risk factors later on in life. So knowing that, I'm going to teach you today what some of those next steps can be. And we'll go through those together. So if you don't know what PCOS is, it's polycystic ovarian syndrome, which means you have cysts forming on your ovaries. Sometimes there can be a few, sometimes there can be many, sometimes they can be small, sometimes they can be very large, sometimes they can rupture. I mean, this is a very uncomfortable condition when you're developing that many cysts on the ovaries. Now, typically, it comes with some pretty classic symptoms. Now, we're going to talk today, there's classic PCOS, and then there's not classic PCOS. So just because you don't have some of the main things I might mention, doesn't mean you might not have some cyst formation and some things going on those ovaries as well. But classically, symptoms of polycystic ovarian syndrome are weight gain or obesity. A lot of women with PCOS tend to not be able to lose weight very easily, or you gain weight really quickly. That's a very common thing that comes along with PCOS because of some of the causes, which we'll get to in just a second. But weight gain is a big one. Acne and skin issues, excessive hair growth, especially on your face and your body. So especially like younger women in their 20s or even girls in their teenage years, if they're already getting facial hair growth, body hair growth, that is a sign of a hormone imbalance, right? That shouldn't be happening, especially that young. It really shouldn't happen at any point, but especially in those younger years, if that's happening, start thinking we might have some of the underlying causes of PCOS. Irregular or really painful cycles. You might get a couple of cycles back to back and then none for 3 months, and then you bleed for 2 weeks, and then none for maybe a month or two, and then a couple more back to back. Just really inconsistent cycles that don't seem to make sense typically go along with PCOS, as well as infertility, definitely, but early miscarriages and things like that as well, inability to get pregnant, but also early loss in that first trimester. Those are all things that typically come along with PCOS. So if you've developed any of those, start thinking, if you haven't gone down this train of thought, that might be the next place to go. Now, there are several different ways that you can get checked for, hey, everyone jumping on, that you can get checked for PCOS. And obviously I'll have my favorites. So you can get it done through a pelvic exam at your doctor, right? Sometimes they can feel if there's abnormal growth around the ovaries, if the cysts are large, especially a pelvic exam could give you some idea on that. The most diagnostic for actual PCOS is an ultrasound, right? Finding cysts on the ovaries. That would be one of the ways to diagnose this. But then also looking for signs of the underlying root causes, which we're going to talk about through proper testing of your metabolic function and your hormones. So all three of those ways can help diagnose. However, only one of those ways will actually tell you what to do to help control it or fix it, because just the pelvic exam or just the ultrasound will tell you you have it, but you still have to go down the rabbit hole of, okay, for me, what caused it, right? Which is why I'm always a fan of getting testing, because the cause of, let's say I had 10 women with PCOS, our causes are not going to be identical. Some of them will be very similar, and we'll go over those today, but there's always going to be a couple of intricacies that will make or break, right? Whether you can get this thing under control or not. So I highly recommend, we'll talk in detail about the testing today, getting that done, whether it's for yourself or a daughter or whoever it might be that you either know has PCOS, right? You've been diagnosed, or you have some of those symptoms, the weight gain, the acne, the hair growth, inconsistent or irregular cycles. If those things are happening, clearly there's an imbalance somewhere, right? It's time to start investigating those. And testing is always the best place to do that. So let's talk first about traditional medical treatment for PCOS, and then I'll explain why for a lot of you, it doesn't go the way you hope it's going to go, right? So the two main things, if you get diagnosed with PCOS, if you have symptoms, typically, and tell me in the comments, whether it's you or someone you know, is this exactly what happened? You're having painful periods, you're having irregular cycles, you're having acne, you're having all these things. The first thing they're going to want to try and do is put you on birth control, right? Because that is the medical way to balance hormones. I have talked in detail about birth control, and I will continue to make more videos about how birth control doesn't balance anything. It doesn't balance your hormones. It squashes your hormones. It turns off your innate ability to make hormone. And long-term, it comes with a lot of risk. And a lot of women who have PCOS do not tolerate birth control very well, because what I'm about to show you with a typical pattern, hormone pattern of PCOS, it only really helps reduce estrogen and progesterone. It doesn't do a whole lot, maybe a little bit, but not a whole lot for your androgens, your testosterone, which is the main cause of PCOS. So yes, it might help you regulate your cycles, but it's not really affecting the true cause, which is why you don't get the full success that you're hoping for from just starting birth control. So that's the most typical thing you'll get with PCOS. And then if you don't get great success with that, typically the second thing they'll do is put you on a drug called Metformin. Tell me in the comments if that was also you. It happens so often. Metformin is a diabetes drug, because we know through research, one of the other root causes other than a hormone imbalance for PCOS is metabolic syndrome, which means maybe you have some insulin resistance or an inability to process your blood glucose specifically. You don't have to have diabetes. I think that's the misconception of, oh, I'm not diabetic or I'm not pre-diabetic. You can have problems with your glucose and your insulin and not be in that diabetic or pre-diabetic range. And because there's been so much research about insulin resistance in particular and PCOS, they've now decided that, oh, well, we can put these young girls on a diabetes medication, because if we can suppress the blood sugar, we can slow down the growth of the cysts. And although, analytically that sounds like, sure, that should work, Metformin is a disaster on your body for most women. I have heard horror stories of having terrible side effects, feeling awful, getting incredible like migraine headaches and pain and nausea, not being able to tolerate food. It is not a simple fix for your insulin resistance. Let me tell you that. Now it sounds tempting. So it's like, great, take this pill, you're good. We're going to cut down the insulin resistance. PCOS goes away. It just doesn't normally happen like that. And granted, people are typically coming to me because they have not had great success with the other routes, but I have yet to meet a woman who had good success or anything positive to say about getting put on Metformin. It's only been negatives. And not that there aren't some out there, I'm sure, who have had great success with it, but it's few and far between. And it's definitely, especially if you're doing this for a younger woman, it's something you don't want to be messing with. That's a really intense, very powerful medication that can have legitimate long-term side effects. However, because the medical community knows it's typically caused, the two causes of PCOS is a hormone imbalance, and I'll show you exactly the type typically, or some type of metabolic syndrome. Those are the two root causes. So they give you those answers. Well, guess what? We have wonderful holistic ways to manage both of those things. So I agree with their diagnosis of what causes it, but I am in firm opposition to the way you're supposed to address this, right? How do we fix this? So knowing that it comes from a hormone imbalance and typically also paired with a metabolic insulin resistance type of an issue, those are the two things we need to test for. Those are the two categories we need to correct and make a plan for. And typically that is going to include nutritional changes. You have to have nutritional intervention with PCOS. If anyone tells you what you're eating is not affecting your PCOS, run quickly in the other direction, because that is just not accurate. We need to balance through different homeopathics and different herbs. There's wonderful things that we can do. And we really have to make sure that we're having a healthy lifestyle, stress management, moving our body consistently. Those are going to be key with PCOS, but there's going to be a few kind of differences that I would recommend for somebody with PCOS that I wouldn't necessarily do if they didn't have that type of a situation. So we'll talk about that and give you some advice on that right now. Don't really have side effects, but doesn't notice that it does a whole lot to help you. Yeah, I mean, sometimes it's just that, right? It's like I'm doing it, but I don't feel like it's changing when I'm expecting it to change, because it's not really fixing the cause. It's just kind of masking it, definitely. Okay, wonderful. So let's go through. I pulled up a lab that has a classic PCOS presentation. So this is typically, if you have classic PCOS, the type of hormone pattern you're going to see. And again, every woman is different. It's not always this way, but this is very classic. So this is, if you don't know, the Dutch test, my favorite test. If you have been following me for any amount of time, you know this is my absolute favorite way to test hormones and adrenals and inflammation and neurotransmitters. Every woman on the face of the planet needs a Dutch test. I will drop links down below of how you can get this test if you haven't had it done yet. It's super easy to complete. It's a 24-hour urine sample. It gets sent right to your house. You send it off to the lab. We can review your results virtually, so you can do it no matter where you live. Really, really easy. And I'll drop that link in the comments where you can get it. But what I love about the Dutch test is it goes so much deeper than a blood draw. We get so much more information that helps make the best decision about how we are going to manage the situation. Now, with PCOS in particular, there is usually 3 things that I'm looking for that would be contributing to that situation. The first one is on this left-hand side. These are called your androgens. Having elevated androgens, which is testosterone in particular, but also these other androgens and even some DHEA, those are the things that have been the most known to cause a PCOS reaction, increased or elevated androgens. Testosterone, and actually this one down here, it's called your DHT testosterone, which is the most inflammatory one. These are really the 2 testosterones that we see elevated the most often in a situation with PCOS. So I'm always looking there first. Do we have elevated androgens? That's step number 1. Step 2, PCOS often also comes with elevated estrogen. Maybe not as elevated as the androgens or the testosterones, but because our hormones are all linked, If your testosterone and your androgens are elevated, you have a higher risk of also having estrogen dominance at the same time, which can also contribute to abnormal cycles, painful cycles, some of the same symptoms as PCOS. So it's not abnormal, just like this example right here, that all of her androgens and her estrogens are way too high. So androgens being high, estrogens being high. And then typically what I also see is a progesterone deficiency. So her progesterone is incredibly low over here in the corner. Her androgens are high, her estrogens are high. This is classic. Like this right here is the snapshot picture of the hormone pattern that causes PCOS. So knowing this and being able to see on the Dutch test where those pathways are, we start to think, okay, where do these hormones have to filter through? Where are they being converted? Why is her body allowing all of these hormones to build up? And in this situation, the most common reasons, one, sluggish liver function. Liver health, I'm going to take this screen off for just a second. Sluggish liver function in PCOS is incredibly important to address because not only does your liver convert your hormones, it also helps filter your triglycerides and your glucose and help keep that metabolic syndrome under control. It also helps get rid of toxins and inflammation that can be caused from having these really high amounts of hormones. And especially for a woman who's had a lot of hormone in her body for a long time, that liver has a very hard time processing all the abundance of hormone that's in there. So it ends up becoming sluggish and weak, even if your liver enzymes and your blood draw for your liver function looks good, right? So don't let them say, oh, your liver looks great. If you have that much hormone, your liver's struggling to keep up, okay? Like it can't keep up with the demand. So making sure we're doing things to really help that situation, and I'll give you some specific recommendations in just a second, but we definitely want to really support and take care of that liver. We also want to make sure that we're helping the body regulate blood glucose as best as we can. A lot of that is going to come from nutritional interventions. So one of the things I do differently with someone who has PCOS and these really high androgens is typically we will start more of a low carb type of a diet. I don't do that with everyone, right? Some women can't tolerate doing too many low carbs because of certain patterns that they have. So it's not something we do consistently across the board, but with a pattern like that, we have to reduce the amount of glucose, of triglycerides, of just the body having to release the insulin to just keep up with that demand. So we are going to reduce carbs pretty much across the board. That means gluten, but it also means rice and oatmeal and things that you might think are healthier carbs when you're having just a general wellness lifestyle, right? Those are not things that I make everyone avoid, but specifically, we're really taking away anything gluten. We're going to take away rice and we're going to take away any other grains like oatmeal and those types of things and really reduce any added sugars, things that contain sugar. We want to be as minimal as possible with any of those things that are going to create a blood sugar spike, because it's in turn going to cause some of those other hormones to continue to elevate. So in a PCOS situation, you're going to want to do low carb. Now, low carb doesn't mean keto, okay? Now, if you're a keto follower and you do great with it, awesome. A lot of women, especially if you have hormone imbalance and adrenal issues and those things haven't been dealt with, keto can be really hard on your body, right? You might not be able to tolerate being that strict right off the bat. Now, if you can work towards that, if you get great success with it, fine. But I wouldn't suggest going all in and trying to eliminate all carbs and go straight to keto. You can definitely create an adrenal issue. Her progesterone was already low, which means there's some stress on the body that wouldn't tolerate a keto type plan very well either. So low carb is really reducing and minimizing sugars, but not going fully into a ketosis state that could create more strain on the body. So minimizing, but not fully restricting to make sure we're supporting those pathways appropriately when it comes to PCOS. So we're supporting the liver. I'll tell you a couple of my favorite agents for that in just a second. We are definitely reducing what we're eating as far as sugars, but we also want to increase whole food nutrition, right? Making sure you're getting a variety of fruits and vegetables, that you're getting good, clean animal protein that has B vitamins in it and choline and things that are helpful for your body to be able to process hormones. So really just choosing a lower carb, really tending towards a whole food diet is going to be incredibly important for PCOS. And then making sure we're supporting those hormones, making sure we are giving the body things that can help decrease those androgens, making sure that we're helping turn on the detox pathways for your estrogens, really keeping those balanced is going to make a huge difference. So liver and metabolic issues, absolutely need to make your food changes, and we've got to balance those hormones for long-term success. And then we want to support those with good lifestyle habits, right? You've got like the simple things, but that we forget about. Half your body weight in ounces of water every single day. If you have that much inflammation, we've got to give it an easier pathway to flush out. We want to make sure we're getting movement every single day. If you're in pain and tired because of the PCOS, if you're overweight and that's hard for you, it can be as simple as walking 10 minutes a day, but I need you to commit to doing some type of movement. We've got to turn that metabolism back on to help. And as you start to feel better and things start to balance, you can add more, you can increase it, but we've got to have those healthy lifestyle pillars to support any other just more additional things that you're going to do for that, right? You can't forget the foundation. I think sometimes I can get caught up in talking too much about the testing and the higher level things, but even that still doesn't work as well as you want it to if you don't at least have the foundation, which is hydration, proper nutrition, movement, and stress management. Those are the 4 foundations. And then when you do those in addition to proper testing, proper hormone support, using the right herbs, that is when really cool things happen. So make sure you're not forgetting the lifestyle pieces and relying too heavily on just the other interventions. So speaking of interventions, I'm going to pull back up that same lab and just give you an example of things I would use in this situation. Now, remember, if you don't know your labs, don't go and just start all of these things, but I'm going to give you some ideas of what can be used for these types of higher hormones. So one of the things when we have high androgens, one of the most researched herbs to help with that is called saw palmetto. If you look it up, you're going to see a lot of it linked to like prostate function. It's also great for that, but it's great to start decreasing or helping your body filter the higher androgens and the higher testosterone. So saw palmetto is a really great tool that we can use in a situation like this, in addition to the other lifestyle pillars for sure. We can also use an herb called passion flower to help reduce the estrogen. That's a good one. We can also use DIM has been really well researched to help just support and reduce some of those estrogens. So saw palmetto, passion flower, or DIM if you have really high androgens and estrogens. In this case, using something like a chaste tree to help support the progesterone could be effective as well. But remembering that the root of this is coming from some type of insulin resistance, we'd really want to focus our herbal strategies there first, right? And then we can add some other things. But what I like to do to support any type of metabolic issues, and there's lots of different things we can use, but specifically in a situation like this, one of the herbs that we add in that works very similar to like what metformin is supposed to do is called Genema. It really helps you just use up the glucose and the blood sugar that's circulating in the body so that it doesn't build up. So Genema is great to be taken around meals. So if you take it like before or right after a meal, it really helps your body kind of manage those blood sugars a little bit better. I actually used it during pregnancy when my blood sugars were moving around a little bit, and it was really, really effective for that. So Genema is huge. One of the things that's used often with PCOS is called inositol. It's a great hormone balancer, just a supporter, but it's also wonderful to help your body regulate insulin, which is really important in this situation as well. So Genema and inositol are 2 really favorable things to use. And then just supporting your liver function. So using my 2 favorite things for liver function. One, using a liver glandular, which is the actual kind of tissues of the liver. If you're trying to support an organ, giving it all of its building blocks is the best way to do that. So a liver glandular is like a multivitamin for your liver, paired with a liver and gallbladder support, which helps the function of the liver. So they do 2 different things. One helps support the tissue, and then one helps support the function. But the 2 of those together, a glandular complex plus a liver gallbladder support, those are going to be your best combination for really supporting the function of the liver. So starting out, if you know you have some glucose issues, if your A1C is creeping up, we'll talk a little bit more about testing your metabolic condition in a second. But if you already know those things are going on, those 4 recommendations, Shannyn, inositol, gallbladder and liver support, and then a glandular complex for your liver, those are great places to start supporting that function. If you're not sure if that's going on, the things that you would want to get tested to see if there's a metabolic issue, number 1, definitely your glucose, but also looking at your fasting insulin, making sure you're fasting and seeing what that looks like without having food in the system. You would also want to look at your A1C, and then you can also look at some deeper enzymes for your liver to see how those are, and checking in on your triglycerides. Those are really the big things, in addition to some inflammatory markers. So we want our A1C, we want our glucose, we want our fasting insulin, we want to see what our liver enzymes are doing as well. But then we also really want to make sure we're checking on inflammatory markers like CRP, which is C-reactive protein, and then homocysteine. Those are really, I know those are a lot of words. I'll put it in the comments for you. But if you want to get those tested as well, just put a comment down below. We can send requisition forms anywhere. You take it to your local LabCorp, get those results back. So if you haven't had a deep dive into your metabolic function and you're curious what that looks like, just put a comment below and we can make sure we get you the right test to draw. But those will give you an idea of what type of a metabolic issue you have, right? What does that look like? Are you more of an insulin resistance? Are you more on the prediabetes side? It's important to know how your body is processing glucose and insulin to make the right choices, especially when it comes to adding any herbal interventions or those types of things. It's a lot easier to make those decisions if we have the right testing. So as always, my number 1 recommendation is start with the lifestyle things first, right? Change the things you have the most control over: your food, your water, your movement, your stress. Make sure that you're really making that a priority. But then the next step is to get the right testing. I mean, you can try all the things I mentioned today, but if those aren't right for your pattern, they also might not work, right? They're great recommendations. I see good success with them, but what if that's not your pattern? What if you don't have classic PCOS? What if you have atypical PCOS and you try all these things and they don't work for you? To minimize frustration and trial and error, I always recommend testing first, because then you can get a much more specific plan. Definitely starting with the Dutch test. Again, I'll drop that link below. If you have PCOS and you haven't had a Dutch test, it's time. Like, that has to happen. And then taking a good deep dive into metabolic and inflammatory markers so that we can properly fine tune what's going on there and support you the best way we can. And just for an example of an atypical PCOS, so maybe you're the person you're like, they tested my androgens and they're not high, or I've had, I don't have the same symptoms. I don't have the weight gain. I'm a pretty normal weight, but I still have all the other symptoms going on. There's a lot of other causes, right, that can cause an atypical PCOS. And really, if the only symptom of PCOS that you have is the actual formation of the cyst on your ovaries, that is typically more of a stress or an inflammatory response in the body. Because picture it this way, this is what a cyst does. It encapsulates and it puts something in like a little jail to protect you, right? So sometimes I see women have bacterial or yeast overgrowth in their pelvic region, and the body starts forming cysts to soak up the bacteria or the yeast. Or sometimes it's like an HPV situation. Any of those viruses can start to trigger the body to want to create abnormal cell growth. It can form cyst formation. So probably 80% of the women I see will fall into the classic PCOS. And then I'll get several women who have cysts but don't have any of those other issues. So then we start looking at other root causes. So if you have the cysts, but not a lot of what I said today sounded like you, really start thinking, what is my body trying to protect me from? Is there possibly an infection? Is there other inflammation? Do I have overgrowth? Why does my body feel it necessary to form those cysts? And if you continue to ask questions like that, why is my body doing this? That's how you find your root causes, right? It's not just about what can I take to make it go away. Everyone wants to ask that question. Tell me the 2 things I can take to make this go away. It doesn't work like that. You have to ask, why is my body doing this? And if we find the why, which we call the root cause, then the body's able to heal. but it's all about asking why and not just looking for the quick fix, which is also why typically the birth control and the metformin may have some success at first or stop working or have negative side effects at the end, because they're just trying to give you a quick fix and the root causes are still there. So you need to make sure you're addressing all of those pieces of your puzzle to really get the long-term health and energy and body that you want. And that vibrant health is what we're all here for, right? Waking up, feeling good, loving our body, loving the way we feel, being able to participate in life and not miss out on moments. That's what it's all about. So make sure you're really focusing on your lifestyle changes. There's tons of stuff. I have tons of videos on lifestyle change and nutrition. Go back and watch any of those if you feel like you're not sure what to do. But if you've done that and you're looking for the next step, testing is your next step. And I'll drop those links below. I'll drop the links to some of the herbs and supplements I mentioned today. If you have questions as you watch this on the replay, feel free to jump on and ask those. And then I'll come back and answer any questions that were on here from today. But thank you guys so much for watching. I hope you learned something. I hope that was helpful for you or someone you know and love. And join me again next week for another live topic.